All right, good morning, everyone. It is July 19th, Monday, 9:02 a.m. And I want to thank everyone for being on the call. Thank you for getting up early on a Monday and being here with me. Just as a reminder, our mission, why we're up this morning, is hopefully not just to make money, but to make a difference in people's lives. So just keep in mind, we are here to improve the lives of our community with affordable health care. So hopefully that is your mission today as you're going out there. I had forgotten to mention our top producer for last month for July 1st effectives. Congratulations goes out to Miss Brenda Powell. I believe this is her first time being top producer at HPM for the month, so we really appreciate all the hard work that she's done. Congratulations to you. You worked hard. I know you have, and she's a customer service guru. And if you ever stop Brenda and you want to know her secrets and tricks, she is not shy to share them with you. But there's really no secret there. It's hard work, it's customer service, it's getting up there and going at it every day. That's really the magic sauce. So those of you that know that magic sauce, just as a reminder, I'd love to see new folks and new faces up there in the top producer goal. So she got to pick the restaurant we're going to this week on Thursday. And so we're going to go have a nice meal. So we appreciate you, Brenda. Thank you for all your hard work and congratulations. Let's jump into the calendar here. Training is coming up. Now, we've got some new health plans that we're going to be rolling out here. So I'm going to keep you posted on what's going on with that in just a minute here. But training, the main thing is although training's starting to pick up, we want to make sure that you guys are focusing on the AHIP for 2022, getting that out of the way, and ensuring that you've got all of your pieces and parts put back together for recertification for all the carriers. So focus on that first, and then, if you have time to do these additional training sessions, we're now going into rollout month, right? So all rollouts are starting to come out. Those of you that were at the Devoted rollout last week, I know you were really surprised on how these plans are evolving. Fantastic benefits for next year, coming with a PPO product. So really excited to see a lot of those things happening. So this morning we've got a few rollout sessions. The first one at 10 a.m. is with WellCare. They're doing their 2022 rollout. This is for the Orlando market. Again, if you're outside of the Orlando market, check with WellCare. You should be getting your emails for your rollout session in your area. If you're not getting those, please let us know so we can connect you and make sure that you're getting those emails. But just wanting to put these things on the calendar for you. That is at the Marriott Airport so this morning at 10 a.m. At 11 o'clock, Devoted's doing their broker and chat session designed for Orlando, but anyone is welcome. At 1 o'clock today, Aetna's doing their social media training. Many of you keep asking, how do I get more leads on Facebook? Well, Aetna's teaching a class on this. That's at 1 o'clock today. Remember, guys, you don't want to try to be learning this stuff in the middle of AEP. This is a good time to start learning all this. And then also today at 1:30, WellCare is doing a second session in Spanish and Espanol. Same place, the Marriott Orlando Airport Lakeside is there as well. Moving on to Tuesday the 20th at 9 o'clock, Devoted's doing another rollout session, 9 o'clock at the Crown Plaza. Again, if you missed it last week, great opportunity to see what they've got up their sleeves. At 10 o'clock, we've got a lot going on here. Humana's doing how to complete your electronic enrollment. Really don't need this because we've got HPM Shop now. We're going to talk more about how that's working. Also at 10 o'clock tomorrow, WellCare is doing a rollout session in Espanol, same place, the Marriott Airport there. Also moving on to 11 o'clock, Devoted's doing an open training class. So jump on there. Anything and all things Devoted is going to be a Devoted week. Looks like a Devoted month, really. Moving on to noon tomorrow, Devoted's doing another rollout session in the Orlando market at the Crown Plaza. 1:30 tomorrow, WellCare is doing their rollout session in English, same place at the Marriott. At 2:30 tomorrow, Cigna is doing a training, Sell More with Social Media. You guys are seeing the trend here, right? Jump on these classes. 2:30 tomorrow, Cygnus teaching social media. And then at 3 o'clock tomorrow, Devoted to doing their rollout session, again at the Crown Plaza. Moving on to Wednesday. Wednesday's easy. Humana at noon is doing their new agent webinar. If you're a new agent with Humana or you need a fresh up because you haven't sold one in a while, make sure you're on this. Now, I just want to make a quick note here. For Humana, you are required to sell at least one policy within 12 months. If you do not do that, they will put you on their no-no list. And what that means is they may terminate your contract, and then to come back to Humana, you've got to pay for your appointment fees for both the past appointment fee and the upcoming appointment fee. So it works out to be about $200. So if you are planning on writing Humana, make sure you do at least one application in 12 months because you don't want that to happen. I've seen it happen. All right, moving on to Thursday, doing our weekly training session, and I'm going to come back to that in a moment because we had great success last week. Thank you, Tom. So Tom's hosting our HPM Shop and AHIP training session. Come on in with questions. We're going to cover the new enrollment platform that we have, HPM Shop, as well as going over the 2022 AHIP. If you haven't got through that, please make sure that you stop in and we can help you with that. Noon on Thursday, Humana Silver Sneakers. They're going to go through the gym membership program. That's on at noon on Thursday. Moving on to Thursday at 3 o'clock, Humana is covering TRICARE. Always a great session learning about our veterans and the TRICARE program. That is at 3 o'clock on Thursday. And then last training of the week, Humana is doing their AEP rollout. This one's for the Daytona market, and that's at 4 o'clock on Thursday. So no trainings on Friday. Use that day to catch up on your recertifications. So hopefully you guys can get these knocked up and you're on point with that. Remember, guys, always keep one foot in the classroom and the other one in the field at all times. Very important. That's how you train your clients, customers, prospects. You got to impress them with how much you know. All right, so we have some new contracts that are coming in and want to be on the up and up with this. The first one that keeps popping up is Blue Cross and Blue Shield of Florida has now announced that they will allow brokers for the first time to sell all of their Medicare products. Now, this is just for the Medicare market. It is not ACA. Those are still captive positions, but Blue Cross and Blue Shield is now opening it up, and yes, health plan markets will have a contract with Florida Blue. So be on the lookout for that. We should be rolling that out this week, and if you are interested in getting the Blue Cross Blue Shield Medicare product, please send Jessica a note, and we'll make sure to send that out. We'll also make a general announcement as well, so all you got to do is click the button in your emails, but it's very important that you check your emails on this. But if you want to get on the wish list, go ahead and reach out to Jessica, and she'll put you down and make sure that we get you started with Blue Cross Blue Shield of Florida right away. Again, this is just for the Medicare products, not for ACA, and we are already setting that up. We wanted to make sure that we got everything in line. Sometimes it takes a little bit of time. In addition to that, we are working on Blue Shield of California, so those folks that are in the California market will be setting that up shortly. So appreciate your patience on that. And then Kaiser Permanente is making some moves in the Georgia market. 5-star plan there, sell year-round. And now with HPM Shop, once you get your license in Georgia, you can sell from anywhere in the country as long as we're there with you. So that's why I'm making these announcements, because right now, because of HPM Shop and because of the state of the world, you're not just limited to Orlando or Tampa or Florida. You have the entire nation to do business in now, as long as you're contracted, certified, and licensed in those states for each of those carriers. But we're happy to help you with that. We have seen agents selling in multiple markets, and there's no other way to do it without HPM Shop. So I really hope you guys get started and get that out of the way. Also doing Ultimate Health Plans. I announced that back a little while ago. Ultimate Health Plans, we now have that contract. So if you are selling in the Tampa area, Lake Lake County area, they have a very, very strong chronic plan, or if you're selling in the Treasure Coast area as well, Indian River and down into, I believe it's Martin County there, or St. Lucie County, just make sure that that you take a look at Ultimate, because that is a killer plan and only going to improve for next year. So make sure that you request that contract so we can get you up and running for AEP. All right, so we were talking about HPM Shop, and again, you know, the training for the week is getting in there on Thursday at 10 o'clock. Tom is going to be there to help out with folks. We may do this remotely as well, so just before you come in, just give us a call. But HPM Shop is that quote and enrollment tool. And I have to say congratulations to Kelly. Kelly Harrington started using it last week. I think he did 2 or 3 apps on it. And I'm really, really proud of him to make the leap and start using that brand new system. You know, we've made a really huge investment in this product, and we really hope that you're taking advantage of it. So get in there, learn HPM Shop, and get your enrollments done. But, you know, for now, you guys, we still have to remember to report your sales. So after you get in there and you do your application in HPM Shop, which I'm showing you right now, you know, you can go ahead and report your app. If you forget to report your app, no problem. You just go on back in there, you type in the person's first name, and it's going to pop up their profile, and it has the whole application and all the information in it. You can see, you know, the zip code. You can see when it was last updated, all of that. So you can download your results too. So it's really, really fantastic system. One thing I will mention is do not forget about the scope of appointment. I think I've heard about last week a few agents that, you know, forgot to submit the scope of appointment first, and you'll get all the way through the application and it won't let you continue. You've got to have that scope of appointment done. And remember, the system can either email them or text message the scope of appointment. So you can text your client, they can go ahead and sign the scope from their phone, or you can email them as well. So really slick, and it just keeps you in line. So that way there's no mistakes, there's no issues, there's no oops, I forgot. So I know you guys are talking about the scope, but you've got to get them to sign the scope of appointment before you talk benefits. So please don't forget to do that. It's really key and critical to get that done. Once you've plugged in the application, everyone knows that we need to go into our app report. So you're going to go right on into the app report, and same deal here, just plug in the information. You can do it side by side, you know, just open up your HPM Shop, and then you can go down side by side, and you've got it, you know, plugged in. This is going to be important, guys. If you're not reporting your applications, how can we help you when you have an application issue? How are we going to do your mailers? How are we going to set up your appointments and call your book of business and set up your AEP calendar for you? How are we going to do your text message campaign or your email or your voice blast campaign? You know, we need to make sure, you know, or your letters, your book of business letters, all those things. If you don't have it all organized in one place, you're going to miss clients. Some of your clients aren't going to get your letters. They're not going to get the phone call, and they're going to walk into a grocery store and enroll with another agent. They thought that you forgot about them. Don't let that happen. Okay, be on top of your book of business. It's really important, almost more important than your commissions, right? Because you have to know who you've enrolled, and you have to keep that all in one place. Okay, you have your CRM system. This is how the data is going into the CRM system, which is then going to sync in with HPM Shop. But for now, we need to go ahead and report your applications in order to make sure that everything is set and lined up and ready for AEP. Many of you are working with providers, doctors' offices, and we are having conversations behind the scene about our producers, the ones that are actually putting business into those practices. The only way we know that you've done an app for a provider, for a doctor, for a primary care, is if you report your application. And that is how Nick is going in and saying, hey, look, this week Justin did 3 applications for you. What are we doing for Justin this week? Now, it goes across the board for all the big doctor groups, from CenterWell to WellMed to Optum to IMA to Dedicated. All of these provider groups, Nick is having these conversations, Surgery is having these conversations because we're able to show them, not tell them, but show them that there's applications that are coming through for their provider office. So I cannot stress to you enough how important it is that you report your sales after you've done your enrollment. Towards the end of the HPM Shop, you'll have a confirmation code on the right. So plug in that confirmation code, because if you have any issues with your applications, this is how we're going to be able to jump in, dive in, and help you as well. Okay. Now, I do want to go through the Part D explained for 2022. Before I do that, I just want to give you an update. These calls that I'm doing right now are being recorded, and I am placing them on YouTube. However, I've moved the link down to the bottom of joinhpm.com. So you just scroll down to the bottom right, and if you're online right now, you can see exactly where I've got those links for the video. So just make sure that, you know, I'm going to link back to this video right here, so you can go to joinhpm.com on the bottom right, and you've got the latest update, these calls, to keep you up to date on what's going on out there in the industry. Okay. All right. So I am going to jump over to a different screen here, and we are going to talk about the Part D. Okay. So we've got Part D now for 2022, the new things that are coming out. So I want to talk about this because I'm getting some confusion from agents when we talk about Part D. So the first thing that you have to know is that there's still stages in Part D, and everyone on January 1st starts at 0. So on January 1st, it all resets. Everybody. So even if you spent $10,000 on medications, it resets on January 1st. Okay. So the first phase of the prescription drug, and this is the standard benefits, right? So the plans can kind of take these phases and adjust and choose which medications go where. But this is the government standardized benefit plan for 2022 for Part D. So the first phase is your deductible phase. Okay, so if you went out there and you purchased a Part D program, the Part D program can say, yes, we're going to have a deductible on this plan. For 2022, the deductible is $480. Now that is your prescription drug deductible, and it's only for prescription drugs. So that you have to pay the first $480 in the year towards your medications. So if your meds are, you know, $48 to go pick up, you're going to have to pay the first 10 fills in order to get to your $480 deductible. Now, most Medicare Advantage plans, most Part D plans do not have a deductible. They waive the deductible, and again, that is their right. So basically, they're going to take care of that deductible. But under the Part D guidelines, the plans could go ahead and ask for a deductible. Now, sometimes we're seeing deductibles just on brand name medications, sometimes on everything, but for the most part, you know, most of the Medicare Advantage plans waive that deductible, but sometimes they're there. So just pay attention to that, especially on the PPO plans. We're seeing that the brand name drugs do have that deductible, and it may be $480, which is the top level that they can charge, or it could be less, but it'll never be more. It could be less than the $480, but that's your first phase. There is that deductible phase. After you've cleared out the deductible phase, after you've hit your 480, or even if it's waived, you're going to go into the initial coverage phase. And this is where the enrollee is going to pay approximately 25% of the cost of their medications. Now, this is in the form of copays. So you're seeing 0 for Tier 1, 0 for Tier 2, $35 for Tier 3, you know, $80 for Tier 4, and then you've got a Tier 5, which is usually a percentage. Some of these plans now have a Tier 6 for specialty medications. So wherever that lands, that's where those copays come in. So you got to meet your deductible first, and then you're going to pay your copays. Again, it's approximately 25% of the prescription drug cost. Okay. Now, as you're going through the year and you're filling these medications, maybe your member has, you know, a few non-preferred brand name drugs and a few brand name drugs. You may go ahead and hit what we call the coverage gap. Now, I've heard people say, hey, well, I thought the coverage gap went away. Well, kinda. It's still there, but the enrollee doesn't feel the effects of it. So this is what I wanted to go through. So once you're paying your copays, once you hit $4,430 of the total cost of drugs, so this is what the enrollee pays, the actual plan, what they pay, and anyone altogether, what's the total cost, what's the bottom right number of what that drug costs. Not just the copay, but what the actual drug costs to get it filled. And once that reaches $4,430, you're in what we call that coverage gap, okay? So during the coverage gap for 2022, the enrollee still pays 25%, okay? So that's where I say they're not really going to feel the effects because in the initial coverage, it's still 25%. So the copays will continue, okay? So they'll pay 25% for the generics and 25% for the undiscounted cost of the brand name drugs, okay? So there's an asterisk there, and I'm going to read this, and then I'm going to kind of re-notate this because this is actually from CMS. In the coverage gap, as previously noted, drug manufacturers pay 70% of the cost of drugs, of brand name drugs, through a discount. Although not paid by the enrollee, the discounted amount of brand name drugs counts towards the enrollee's annual out-of-pocket threshold, while the enrollee cost sharing for brand name drugs is based on the undiscounted cost. Coverage gap percentage division goes enrollee 25%, manufacturer discounts are 70%, and the plan pays 5%. That gives you the total of 100%. So basically what's happening is the enrollee still stays on that 25% mark, so they don't feel the effects. So they're going to continue to pay their copay as normal, but the division of who's paying in the background is changing. It's changing to the manufacturer and the plan, okay? So now that affects, you know, the out-of-pocket threshold for the member. So you're going to continue to pay your copays until you hit $7,050 for the year, and that's when you're right at catastrophic coverage. Now that $7,050 is not that total cost that was that first marker. It's what the member actually came out of pocket with. Okay, so from $1, excluding your deductible, of course, $1 is $7,050 out of pocket. At that point, if the member has paid $7,050 out of their own pocket for the year in prescription drug coverage, then they'll fall into the coverage gap. Okay, in that coverage gap, they're only going to pay 5% for the rest of the year. Okay, so the drugs for next year, top line, you'll pay about $9.85 for brand names and up to $3.95 for generics. 95% of the cost is going to be covered by CMS, the plan, and the manufacturer. They're going to figure that out in the catastrophic coverage phase. So there's very few people that I've run into that go into the catastrophic coverage phase, but it does happen. A lot more folks used to fall into the coverage gap. So you're going to see less and less people falling in the coverage gap just because that coverage gap kind of takes care of itself. But they did move the fence back on the $7,050, meaning that the member is going to start paying a little bit more out of pocket because it's an undiscounted rate. So wanted to go through that. Remember, I think Part D is one of the areas that each agent really has to master, because if you can explain to somebody why they're paying what they're paying in the middle of the year, you may be able to prove yourself as an expert and you can win their business, okay? But you're also doing the community a service. This is a very complex part of Medicare, is the prescription drug coverage. And by you becoming an expert at it, a master at this, and understanding exactly how Part D, not just understanding it, but teaching it. If you can go out there and teach Part D and you feel confident to teach it and show people the ins and outs of Part D, you will be very successful at what you do. Now, we also have Medicaid and LIS, and that all comes into the mix, and I'm not going to go through that today because that will confuse you all, but you need to understand how all those inner workings come together, because prescription drug coverage is a huge part of what you're going to be doing. Now, in HPM Shop, you're going to be able to go in there and plug in all the medications. In fact, you can pull down their medications from Medicare.gov once you set them up with an account. You can go back 18 months and get their medications that they filled in the last 18 months in their Medicare portal, and it comes right into HPM Shop, and you can see what medications they're currently taking, the milligram dosage, and all that. So you'll be able to quickly spot whether a person is going to hit the coverage gap or go through into catastrophic coverage. And this is important because they're going to say things like, well, I only pay $3.95 for my drugs, but in the beginning of the year I have to pay this. And you have to read that, and you have to understand, you know, that this person may be taking a lot of brand name drugs, and then you have to know what plan is going to be best for them. The good news is HPM Shop is going to do that thinking for you. So as long as you plug in those drugs properly, you plug in the doctors properly, it should kick out the best alternative plan for them. But it's really important that you understand how to explain this, because this could really help you grow your business and protect seniors from unnecessary out-of-pocket prescription drug costs. Also, this is a pro tip. Once you're able to explain the Part D, you can take this to your providers and your pharmacies and have conversations with them. Once you become an expert at the pharmacy, guess what happens? They start sending you business because they say, hey, look, this guy Justin really knows what he's talking about with Part D, and I have all these members over here that are upset because they come in April, May, and June, and you know their copays have changed. Or maybe now it's in August, September, October, right in open enrollment, and they're complaining about their prescription drug costs. Well, I got somebody on staff that can help out. So here's the agent. Call the agent, and he'll take care of you. Pharmacies are a great lead source, guys, but you really got to prove that you know what you're talking about, and I think Part D is there. So this information that I pulled today, you're seeing on the screen, is from the 2022 AHIP. So it's in there. If you download the slides, you can have it as well. If you're not seeing the screen, you can come back. Again, the video's on the bottom right corner of joinhpm.com. I'm going to send you guys a text message as well and an email so you can get to that link and ensure that you've got what you need to be successful out there. So that's all I've got for today. I really appreciate everyone being on the call and listening to all the good stuff that we've got. What I am going to do is open it up. If you have any questions, now is the time.
Hey, Justin. Good morning. It's Kelly.
Hey, good morning, Kelly.
When did you say WellCare was offering the another session for their first look, please?
Yeah, you got it. So today at 10 in English. I'm assuming you want the ones in English, right?
Of course.
Yep, so there's one today at 10 o'clock and then tomorrow at 1:30.
Okay, very good. And that's held where again, please?
That is at the Marriott Orlando Airport.
Oh, wonderful. Right off the B-line.
There you go. There you go. Then they may have sessions in the Brevard market. Just keep an eye on your emails because those may come out as well. But this is the first session in Orlando.
Okay. Thank you.
You got it. You got it.
Oh, actually, I was thinking, do you think that they would also are planning on maybe doing a virtual?
I haven't heard that, but I believe that they are from the last that I talked to them.
I could just reach out to Brenda or somebody.
Mm-hmm. Yep,
okay.
Yep, absolutely. Yeah, they'll usually start doing the virtuals if it's like last year or the year before. Towards when we get closer and closer to AEP, they're not going to be able to do a lot of physical sessions, so they'll probably have virtual sessions as well. Okay. Any other questions this morning? All right. Well, fantastic.
Justin, can you hear me?
Good morning.
This is Leah from Jacksonville. Good morning.
Good morning.
I was wondering, how could I be a part of HPM Shop? Do I just email Jessica?
Yeah, you could let Jessica know, and she'll connect you with John. John is our HPM Shop guy, If you've recently onboarded, you should receive a link shortly, but if you want to check in with any teammate, we'll go ahead and get you rolling on that.
Okay. I did recently onboard, but I haven't finished my AHIP yet.
Okay, yeah. So as soon as you are ready to sell with at least one carrier, when you're ready to sell RTS, that's when Jonathan will be notified to send you out the link.
Okay, thanks.
You're welcome. And guys, just as a reminder, Jonathan has sent out instructions for those of you that are already ready to sell for the year. He's already emailed you instructions on how to get started for HPM Shop. So if you haven't done it yet, please do so as soon as possible. You don't want to be scrambling in the middle of AEP trying to figure out this software. It's the last thing you want to do. And then also, I know some of you only have one contract with us. This isn't going to work. HPM Shop isn't going to work with just one contract. This is not going to make sense for you. You want to have all of your contracts at HPM so you can see what's going on, and you're going to be able to compare plans. If you've only got 2 contracts with HPM, you're only going to see 2 plans, and it's going to make your life a lot harder. So that's the whole purpose of this, is making sure that you have all your plans all in one place. So check your emails. Make sure that you click the link and get your HPM Shop set up. I know we went through a server issue last month. Jonathan's got all that fixed up. If you're having issues, getting your emails from HPM Shop, please reach out to John so we can get you set up. We want to make sure that you're getting the communications and getting your HPM Shop up and running. This is going to become your heart of your operation. It honestly will. It's going to become your dashboard, your headquarters. It's everything. So thank you guys for making sure that you get that set up, because John has worked tirelessly to get this set up, and now he's got to set it all back up for 2022. Believe it or not, we've got to send all of your websites and certifications up to CMS to build out your HPM Shop for 2022. So we got to do it all over again. So he's been awesome with doing that. So please make sure you're doing it, because he's building it for you. He's building it for you, and we want to make sure you're using it. So, all right. Any other questions this morning? Okay. All right, everyone. I thank you for being on the call. And remember, these are recorded. They're going to live on joinhpm.com. If you have any questions or if you need help, you know how to reach us, 844-696-3975. I hope you guys have a fantastic day.